often say age is just a word, but in fact, when we're talking about immunisation, it's a really important word. So chronological age is a defining risk factor when we talk about vaccinations. And so governments and national immunisation technical groups actually look at the vaccine and look at its effectiveness in certain populations. So generally, we talk about older people in the context of vaccinations, at about 55 or 60. But of course, the other trick to this conversation is that in many countries, in low and middle income countries, then those populations don't have the opportunity to grow into their 50s, 60s and 70s. But generally, and according to the United Nations, it's about 60 years of age is a person that's regarded as older, because they are in the third part of their life. So, it's the definition, is it creeps, but it's about 60 and over or 50 and over, older adult, older person. I think we need to step back about older people being a risk group to start off with and say that influenza vaccines are a safe and effective way to help people stay healthy and prevent illness and even save lives. Now, older people are categorised as in a at-risk or higher risk group because as we age, our immunity, our response to infections decreases over time, and it's called immunosenescence. So we're more at risk of serious complications of influenza, and that may mean death, but it may also mean deterioration in function. So that's why older people and also those with underlying chronic conditions are regarded at risk of serious complications. Now, the other thing that we need to remember is as we grow older, there's an increasing likelihood of having underlying or chronic comorbid conditions such as diabetes, cardiovascular disease, respiratory infections, and that increases the risk even more. So you can be an older person, natural immunity wanes, and then this chronic condition of diabetes, which then impacts the impact of infectious diseases. All people should be vaccinated against influenza, and older people, whether they have a chronic condition or not, should be vaccinated because that is one of the most effective public health mechanisms. It's a preventative tool and it will help maintain your health and also maintain your function, and it will save lives. What we're trying to do in public health is to create an environment that enables older people to do what they have reason to value, and vaccinations against influenza every single year is critically important to maintain healthy aging. When? Now, in the Northern Hemisphere, where I am, in Canada, it takes about 2 weeks after vaccination for antibodies that protect against flu to develop in the body. So it's best to be vaccinated before flu begins spreading in the community, and generally about September, October are good times to be vaccinated. June, July, August are not the most appropriate or effective times for older people to be vaccinated. The rates of vaccination for influenza in adults is suboptimal in many countries of the world, and there are many reasons. They're often situational or geographically specific, but one of the most important ones is that being healthy, people actually think that they don't need to be vaccinated, and that's incorrect. Everybody needs to have that effective protection against the influenza virus. Secondly, sometimes it's very difficult for an older person with mobility problems to actually go to the doctor or go to the pharmacy. And that's why innovations in vaccination is so important, such as a mobile clinic going to a community centre. A third reason is some of the public health messages about influenza are not targeted to older people or those populations most at risk. Public health messages assume the same level of health literacy of all older people, and that's not the case. Regrettably and unacceptably, some vaccines in some countries for influenza cost money. And when there is little money in the house, we've heard that grandparents would rather ensure that their grandchildren are vaccinated before themselves. The final comment would be that I think generally, we've almost become normalised around influenza. And many of the population think that a common cold is the flu, and that's incorrect as well. So it's critically important that we look at public health messaging, expanding vaccination pathways, looking at reimbursement for all, and making sure that, those targeted populations know the risks, but also know the benefits of being vaccinated. Immunisation policy is informed by recommendations from the National Immunisation Technical Advisory Groups in many countries. To start with, we need to have a very robust education program, public health campaigns. And these campaigns need not only be on a website, they have to be in all of the places that older people visit. In supermarkets, in pharmacies, on public transport and community announcements. There's some good practices. There also needs to be the opportunity for an older person to actually have a conversation about their concerns, the standard versus the enhanced vaccine. When we look at access, we need to make the pathways to being vaccinated really easy. So an older person should not have to go to their GP, get the prescription, go to the pharmacist, go back to the GP, because they won't do it. So making the pathway to the vaccination as simple as possible. Have the pharmacist, be qualified to administer the vaccine, or have mobile clinics go out to the communities, have special time when older people can actually access vaccines easily. We must learn from the lessons of COVID. And finally, equity. So I've touched on prevention, access, equity. We must also consider that populations have different levels of health literacy and look at equity within the context of the social determinants of health. My last comment looks at the framework for public health messaging. First and foremost, implement a life course approach to vaccination at the ground level. Secondly, ensure that there is a clear vaccine communication strategy. And not only government drives it, but patient organisations, PR companies, advocacy organisations coming together around a common agenda. The IFA has pledged to view all of our work portfolios through the lens of the 4 action areas of the United Nations Decade of Healthy Ageing: ageism, long-term care, primary integrated care, and age-friendly cities and communities. We are joining with other patient and advocacy organisations around the world to ensure that the uptake rates of adult influenza vaccination are viewed in each of those 4 action areas. It's through voice and engagement of older people. It's through data collection. It's through leadership. And it's through the inspiration of those that we work with, we can drive the agenda for the world's ageing population.